This is a case of a 2-year-old boy who presented with abdominal pain. He has no other symptoms apart from a little bit of alteration in his bowel movements, and he's a little more constipated lately. So he came in for an ultrasound abdomen. The solid viscera of the abdomen appear normal, but towards the right of midline, to the right of the umbilicus in the lower quadrant, few discrete enlarged lymph nodes were identified. 1, 2, 3, 4, 5, and the largest of which is around 5.5 millimeters in size. So there is no signs of any appendiceal inflammation. There is no evident bowel thickening, no abnormal bowel movements. There is no free fluid, just some mesenteric lymph nodes. In the absence of any other findings, we should raise the possibility of mesenteric lymphadenitis as a differential. So now let's have a look at what are the findings in mesenteric lymphadenitis. It is basically identifying enlarged lymph nodes in the mesentery. Okay, it is usually seen in the right lower quadrant abdomen. There are usually a few discrete enlarged lymph nodes. Earlier, the definition was 5 millimeter or more in size, 3 to 4 lymph nodes would suggest mesenteric lymphadenitis. But the revised definition suggests to hone in on mesenteric lymphadenitis only when the largest lymph node, even if one of them is more than 8 millimeter in size in the short axis. There are two types, primary and secondary lymphadenitis. Secondary is when it is due to a secondary cause, like for example, appendicitis, inflammatory bowel disease, SLE, sarcoidosis, or other chronic granulomatous disease. The primary mesenteric lymphadenitis typically occurs in the first decade of life, while secondary causes usually occur in the second decade of life. Almost never would you encounter primary mesenteric lymphadenitis after 20 years of age.